So cartilage and bone. Let's first start with cartilage. Cartilage is avascular, and it doesn't have innervation. Avascular means that it is not getting a blood supply, and that means if you break through cartilage, it's not going to heal very well. For example, in the next few slides, I'm going to show you something, part of bone when you were growing, called your epiphyseal plates. And these are commonly referred to as your growth plates. And if you actually break your bone through the growth plate, the cartilage, it doesn't heal well. And it could mean that your bone won't be able to lengthen as well as it should when you're going through your growth spurt. So recently, my son, he had a FOOSH. That stands for fall on outstretched hand. That's frequently what they put in the charts as well. So I brought him to Mammoth Mountain Hospital, and I said to the front desk person, I said, we have your typical FOOSH here. And she's writing it down. And the nurse behind her tapped her on the shoulder and said, you have no idea what she just said, do you? And she went, no. She said, fall on outstretched hand. I said, yeah, I mean, I'm sure you see this every 30 seconds. So what got them all confused when they took his x-ray, he had a pretty bad break. They couldn't understand how he broke his wrist. He actually broke his distal radius. Have you started to learn about your appendicular skeleton? So he broke his distal radius, but thankfully he did not break it in his epiphyseal growth plate. That was still intact. And they were really confused that he broke his wrist while skiing because that's typically a snowboarder's injury. Until both Mac and I went, he doesn't use poles, ever. And then they went, oh, that explains it. Because they just could not rack their brain around it. Lacks innervation. That means if I actually puncture through your cartilage, you're not going to feel it. It doesn't have innervation. Now, how many of you have had your ears pierced up here? This is elastic cartilage. Did it hurt? Yes. Because your skin is innervated. So as the needle was going through your skin, that's what you felt. But when it was actually going through the cartilage, what you felt, if anything, was the pressure that the person had to apply to shove it through that thick cartilage. And you thought, that was a poor decision, wasn't it? No? It's mostly made up of water. It has a lot of ground substance. And when you go through your homework packet, when you're watching the tissue video, you should have your homework packet out with you because you'll be able to fill in what kinds of fibers, what kind of ground substance each of these tissues have. Some tissues have more cells with them rather than stuff out in the periphery. For example, think of you all as individual cells. You are part of my anatomy tissue. You have a lot of paraphernalia that all of you schlep in every single day, right? But I'm seeing mostly a 1-to-1 ratio. But for those of us who come in for a long day, I'm here until 10 o'clock at night. If you saw me come into class today over in my office, I had my purse, I had my lunch, I brought in more food for the students, I had in a big box of books for our one campus, one book drive that we're having. I had a lot of things that I had to schlep in because I'm doing a lot today. Some cells, tissues are like that too. Some cells, you see more cells, less paraphernalia, less stuff out around them. Some cells are sort of like, well, I could say it because I am one, trailer trash. A lot of stuff out in the yard. Don't really get rid of a lot of junk. So there's a lot of stuff outside of them. That's the ground substance and fibers that you might find. So some tissues are a little bit more cleaner than others. Hyaline cartilage, elastic cartilage, fibrocartilage, they tend to be some of the more cleaner types of tissue. Cartilage is different than bone in that it's very resilient. It's softer than bone. Elastic cartilage, for example, is perfect. Right here, do this to your ear. Okay? Cut it in half. Not cut it in half, but squeeze it in half. Now let go. It didn't stay that way. Thank goodness. Because could you imagine if we woke up after sleeping on our ear like that overnight, you know, every once in a while you do that, right? And that's how your ear stayed. It would be crazy. You'd be like, I can't wait to go back to bed. I got to flatten out my ear again. So it's very resilient and it snaps back into place. It's going to allow for your different joints to glide past each other. You should have learned, if you're learning your appendicular skeleton, that there are some bones that kind of would rub up on each other, like the condyles of the tibia and the femur. Well, thankfully, you've actually got pads of cartilage in between that to help cushion the impact. But also at the ends of bones proper, they have articular cartilage, a band of hyaline cartilage to wrap around it, again, to help smooth out that friction. Because if not, if bones start having frictional rub, guess what happens? It'll start aching. And it will produce pain because bones are innervated. And if you start rubbing them and you erode down to the nerve, you're going to feel that. That's why some people have to have knee replacements, for example. But they also are a model for most of our long bone formation. When we go through our growth spurt, most of our bones are going to be modeled through endochondral ossification. I'll explain what that means in just a moment. But it's also giving support to other surrounding soft tissues. So cartilage does a lot more than just being a model for bone growth. There are two different ways for cartilage to grow. There's appositional, that means from the edges, you're growing out from the edges, and then there's going to be a growth where it grows interstitially, in the middle, and I'll explain the difference in just a moment. When we look at cartilage, there is fibrous material on the outside of it. Chondros means cartilage. So perichondrium is the outer layer around cartilage. You can think of your own clothing as an outer layer around you, the soft person you are. It'd be awkward if you came in here without your article of clothing, wouldn't it? It's not Naked Tuesday. That's the first Tuesday of the month. That's not today. Thank goodness. So when we look underneath the pericardium, when we pull that layer out, we can actually see some dividing undifferentiated cells. Undifferentiated means if you looked at them under the microscope, you would not know what they were going to become. And I believe in my video I explained that you all are undifferentiated, or was that a different class?
No, you didn't.
Okay, so when I look out in the audience, who wants to be a nurse? Who wants to be a PT? OT? Dental hygiene? Undecided. MD? Who'd I miss?
PA.
PA. Okay. I had to ask that because you all, although you are unique individuals, right now you don't look any different to me. If I go into a clinical setting, I could figure out pretty clearly who's the doctor, who's the physical therapist. They have certain paraphernalia that they have where I could get a pretty good clue as to what they are. So you all are undifferentiated, but you are determined. You woke up one day and you said, I want to be fill in the blank. So these are undifferentiated, but they are determined. When they replicate and they divide and they mature, when we look at them underneath the microscope, once they are fully mature, there is no question what kind of cell we're looking at. Just like when you go through all of your training and your professional schooling and you take your licensure exam, if I see you walking down the hall in a clinical setting, I'll know what you've become. I won't have to ask you anymore. So when the cells become committed, that means they're starting to mature. They're starting to morph into their adult form. And when these cells are mature, they're going to turn into chondroblasts first. And then when they're fully matured and living in their own lacuna, that's like you, living in your own home away from mom and dad, they turn into chondrocytes. So all of this new growth is happening just under the outer layer. That's where it's starting. That's what we mean by apositional growth. So when the new matrix is produced peripherally, that's appositional, versus when it happens in the middle, that's interstitial, as I said before. Here we have a mature chondrocyte. It is going to replicate and divide, and now I'm going to have two chondrocytes in one apartment we call lacuna. It's not really an apartment, but it is a chamber. And these two cells don't like living next to each other. They want their own rooms. They want their own apartments. And what they'll do is start developing matrix in between them, so now they each have their own lacuna. That's interstitial. We have a mature cell already in its own chamber. It's replicating and dividing. It's happening in the middle of the tissue. That's interstitial. Any questions on that one? There are three types of cartilage. The most abundant type in your body is hyaline cartilage. We will ask you to tell us where you can find it. Just an example or two. It is the most abundant cartilage in your body, so it shouldn't be hard to commit to memory where you find it. At the end of your nose, there's a lot of cartilage, unless you were part of the Jackson family. There's also a lot of hyaline cartilage that is allowing your ribs to connect to your sternum. That's called costal cartilage. Hyaline cartilage is also found at the ends of long bones, the articular cartilage I told you about, to help soften that frictional rub, just to name a few. Elastic cartilage, well, I already showed you where you can find that. You find that in your earlobe. Specifically the pinna, this part. You don't find it down here. Most students think this is the earlobe, right? We find it up here. Down here it's just soft tissue. It's up here, you can feel it. You also find elastic cartilage, in your epiglottis. This is the guardian of the airway, as it's referred in textbooks. When you swallow, muscles in your throat elevate your larynx, and it causes the epiglottis to fold over and protect the glottis, which means the opening to your trachea. This means you don't aspirate food that you're swallowing. But if someone makes you laugh while you're doing that, things can go badly wrong, right? And you can aspirate what you're eating. Fibrocartilage. Fibrocartilage helps withstand compressive forces and also tension or pulling. It is very resilient out of the three. Fibrocartilage is found in the intervertebral discs in between your vertebrae. It helps withstand the compressive forces when you walk, and especially when you run. Today I had to be here early, and my dog was so glad that I had to go to work early. So when I go to work early, I don't get to go to the gym and do what I want to do in the gym. She gets to go for a run. So she was super happy about that. And I kept thinking, I hate running on asphalt, but it's making the dog happy. I was very appreciative of my intervertebral discs. You also find fibrocartilage in another place called the pubic symphysis. And this is in between the two pubic bones of your os coxae, your hip bones. Your pubic symphysis is made of fibrocartilage, whether you're male or female, but it's females that get pregnant, and this joint has to stretch as the hips widen. And we appreciate that. We appreciate also that under normal conditions, ladies, our two hip bones don't separate away from each other. But in some women, that does happen. That fibrocartilage is to prevent that from happening. So those are just a few examples of where you find these three different cartilages. We also ask you to identify them by sight. I hope you see that these three pictures are not identical. Let's start with the top right one. To me, it looks like raisins stuck in clear pink jello. That's hyaline cartilage. With hyaline cartilage, what you're not seeing is that there are actually fibers in the matrix. They are there. There is collagen fibers, but in hyaline, the collagen that's used is a different kind, and it arranges in a parallel fashion so that when the light shines through your microscope stage, your eye doesn't see the fibers. It's as if they're crystal clear. Top right is hyaline cartilage. All the little circles that you're seeing are chondrocytes living in these spaces called lacunae. That's plural for lacuna. The next one here, to me it looks like cotton candy with little speckles in it. And what you're seeing here is a lot of collagen. It's a different variety, and it's packaged differently. And now it looks wavy to you, doesn't it? Your eye is picking up on the fibers that are there. And the tiny little dots that you're seeing are the chondrocytes still living in their lacuna. Down here, it just looks messy, looks dirty, doesn't it? You're seeing these circles, those are the lacuna. The cell inside is still a chondrocyte. But in addition to the collagen fibers that you're seeing here, you're seeing elastic fibers. And when we stain for elastic fibers, we have to use a different stain to see them. And the stain that we use to target the elastic fibers makes them stain very dark. They look scraggly, sort of like icky spider webs. So the top one, hyaline. Middle, fibrocartilage. Last one, elastic cartilage. Now we're moving to bone. You are learning in lab about the skeletal system. We're also going to learn about joints. I am not talking about the ones that you smoke. I'm talking about articulations. You can have a joint between not just two bones, but you can also create a joint between the tooth and its bony socket. You can also have a joint between cartilage and bone. A joint does not just mean bone to bone. And we will learn about the different kinds of joints. Joints, just to give you a little prelude, they are classified in two general categories. We learn them based on how much they move or not. That's their functionality. We also learn to classify them based on what they're made of, the structural part of them. And you've mastered learning your joints when you can combine both terms. To be continued. Ligaments hold bones together at the joints. The tendons help anchor muscles to bone. We're going to spend a lot of time learning about skeletal muscle physiology. Even though this is anatomy, we're expected to teach skeletal muscle contraction in this class. By the time you take physiology, I really don't have time to review for you. So you need to take that forward. You need to remember skeletal muscle physiology. And we will spend quite a bit of time on it so that I can pound it into your brain That's why I'm asking you to do some of the easier chapters on your own with my videos so we can spend more time learning the harder concept. We have appendicular skeletal bones. That's what we're talking about, our limbs and our pelvic and shoulder girdles. That means the bones that help attach our appendages to our axial skeleton. So the pelvic girdle helps attach our lower limbs to our axial skeleton. We've got the pectoral girdle, which helps attach our upper limbs. And our upper and lower limbs differ in function, but have you noticed that they kind of have a redundant appearance to them? For example, in your arm, you have one bone, don't you? In your thigh, you also have one bone, don't you? In your forearm, you've got two bones, the radius and the ulna. In your leg, you have two bones as well. But the way we bend those limbs, the way we use them is different. It would be really weird if we could sit on the couch and bend our knees so that we can scratch our nose with the fronts of our toes. That would be weird. Agreed? It'd be really weird if we can bend our elbow this way to scratch the back of our head. That would be weird too. So they have different function, meaning how they bend, but their overall anatomical design is very similar from one limb to the next. What is the purpose of your skeleton? Most of the time we think of it as being a lever system, meaning something your muscle can pull on to move you. But it goes much, much beyond that. Your bone is also a site, depending on how old you are, for blood synthesis, hematopoiesis. When you were an embryo versus a fetus versus under age 20 versus over age 20, where are you right now? No one here is an embryo. When you were an embryo, your blood synthesis occurred in your yolk sac. When you became a fetus, your blood synthesis occurred in your liver and spleen. When you were born and up to age 20, most of your blood synthesis occurred in the red marrow of your long bones. But if you're over age 20, it's all downhill after that. Now you rely mostly on your axial skeleton for hematopoiesis, which means your red bone marrow is no longer red marrow. It's filled with fat. How many of you love cracking the chicken bones and sucking out the yellow marrow? It's tasty goodness. And I like to cook with the bones too and let them simmer overnight because I'm trying to get all the fat out from the bone marrow cavity. Makes the soup a lot more tasty. Trust me on that one. So there's also, you're going to learn that we have minerals. Our bones are not just organic, but they have mineral component. And your bones can actually change in their structure in some regard. We call this remodeling. For example, Mac, he broke his distal radius. He's in week 3 of healing. His bone is definitely remodeling. He still has a little piece of the bone that's sticking out a little bit, but the doctor said, I'm not really too worried about that because your bone cells over time will shave that off. And in my head, I knew what that meant. But to Mac, he heard shave, and he's like, is it going to hurt? He was thinking like a razor blade shaving. I'm like, no, honey, that's not what she meant. Mommy will explain later. So I'm going to tell you about this remodeling process. We also, there's a lot of acid-base balance that comes from your bone. And if you are consuming a lot of acids, like a lot of sodas, you can erode away your bone matrix. You don't want to drink too much of that. It won't only erode your teeth, but also bones, other places in your body. Energy reserves, well, that's the fat that we store in our yellow marrow. So, yeah.
Did you say skeletal muscles have the greatest regeneration?
Skeletal muscle?
Yeah.
It depends. Most of the time, when a myoblast differentiates into a skeletal muscle, it is differentiated and it doesn't really have good mitotic turnover. However, if you suffer from a skeletal muscle injury when you're younger, you might have some regrowth of that skeletal muscle. Again, the younger you are, the more resilient you are to that kind of injury. But if a shark were to attack my biceps brachii and take a chunk out of it, I'm not going to be able to grow that back.
I actually broke my plate when I was 12 or 13, right when I was
Going through growth?
Yeah, and playing tennis, and he was like, yeah, because you're young, the doctor was like, you're young, and so it's going to grow back. If you were a little older, like, you would have problems growing.
Yep. Yep. The younger you are, the traumatic injury that happens to you maybe, the more resilient your body probably is. That's part of the reason why when elderly people fall and break their bones, it is a longer process for them to heal. And it also doesn't heal as well, which makes them more likely to break more bones because now they're weak on one side. And if they start spending too much time in the hospital, it's this weird phenomenon that we see. We say in clinical medicine, if they're in the hospital 3 times within a year, they're probably not long for this world because their mental state changes. They start kind of giving up to some extent. So if your grandparents or your parents, if they're starting to break bones, you got to get them healthy and mended and not have them do any too risky things because we want to keep them out of that hospital as much as possible. My poor in-laws, they drink a lot of tea. They're British. And they put milk in their tea. That's good. It's awesome. But overall, they weren't really drinking as much milk as they should. And unfortunately, between the two of them, within about 1.5 years of each other, my mother-in-law, Foosh, broke her wrist, healed, fell again, hiking. I believe it was the other wrist she broke. That was 6 months later. Then 6 months later, she's back at my house. She and my father-in-law, when Mac was younger, they would come for the first 2 weeks of school so that Honey and I can get to school and get all our students organized because it's a very crazy time for us. And they would take the kids, they'd say, we're going to entertain them, don't worry about a thing. And I'd come home to a clean house, cook dinner. I love my in-laws. Well, they decided to take Mac to the beach, and a rogue wave came up and toppled my mother-in-law. And this is how Mac described it. Mom, Grandma's foot flopped back and forth in the waves. And she had broken both her tibia and her fibula. Her malleoli, you should know what those are. Are you learning about the lateral malleolus and medial? She snapped both of those off. Then about 6 months later, my father-in-law tripped over a sprinkler and landed on both and snapped both radius and ulna in both hands. Could not do anything for himself. Think about that. Nothing. That will bring a marriage together quickly. Fortunately, they listened to me. I said, you see the downstairs bedroom? I remodeled it for you. I made it perfect for injuries too, because it's wide enough doors for a wheelchair. I made the sink higher just in case. Because I know if they get hurt, they're coming to our house. So my mother-in-law got hurt at the beach by my house. She ended up being with us for a long time, and I was like, whoa, it's all part of my plan. Because I would love for them to live with me. Because, again, clean house when I come home, it feels. It's awesome. And so when they kept breaking their bones, I said, listen up. You two keep this up. I will Charlie and the Chocolate Factory your asses into that bed. You will not get out. They're like, we're going to heal. I said, you're right. You are. Go get a bone density test. and they had pre-osteoporosis. So they had to, and so my mother-in-law said, I was taking medication for that, but because I was getting better, I stopped taking it.
Like, stop taking the antibiotic.
And I was like, that's why you stay on it. Anyway, so bones are organs. They are connective tissue. They have innervation. They have blood vessels. And nerves are a different kind of tissue. The definition of an organ is anything that has at least 2 or more different tissues. That's the definition of an organ. Bones are definitely organs. They have endothelium, which is a special kind of epithelium. The endothelium is found in the blood vessels. They also have nervous tissue. That's another kind. They also have smooth muscle around the blood vessels. Muscle is a third type of tissue. And they themselves are connected. So they have all 4 tissue types in them. The big 4, again, epithelium, muscle, nervous, and connective. Bones are definitely organs. When we teach you about an organ, frequently you will hear us say, what is the functional unit of this organ? That usually means, what is the repeating unit you see over and over and over? What is doing the primary job of that organ? And you should be seeing that there are these repeating circular structures. Do you see that? And the blood vessels, blue for veins, red for arteries in this picture, yellow for nervous tissue. Those repeating structural circular units are called osteons, also known as Haversian system. The joke in anatomy when I teach it is there are always 2 names for almost anything in your body, except for when there's 7. There will be times where you're going to say, Kara, you said this, but the book said this. And I'm like, read in the parentheses, I'm right too. So there are a lot of different terms for things. Haversian system was named after the anatomist that studied it. We're trying to get away from naming things after the anatomist because it doesn't give you a clue where to look. But if I say osteon, os means bone, you at least have an idea, I should be looking somewhere in bone. There's also another kind of connective tissue in bone found here in the medullary cavity. We can find adipose tissue. And on the ends of bones, we see another type of connective tissue. We see that articular cartilage that I referred to earlier in the lecture. Epiphysis, diathesis, diathesis. What are all these things? The epiphysis is the edges of or the ends of the bones. We're talking about long bones. Diathesis, if I grab the middle, that's the shaft. Epiphyseal plate is the term I use the most to describe this transition in between the epiphysis and the diathesis. This is where we're going to find the epiphyseal plates, this growth plates that I was referring to, where we're seeing cartilage. At the ends of the long bones, we find articular cartilage. Again, that is to resist that frictional rub. And in the middle, it's kind of hollowed out. That's called the medullary cavity. What can we find in the medullary cavity? Blood vessels. If you're under age 20, your long bones, your medullary cavity is filled with what we say red marrow, because this is where you're making your blood cells, red blood cells, white blood cells, platelets. If you're older than age 20, this transitions into a medullary cavity filled with fat, adipose tissue. That's what I was referring to as sucking out the marrow of chicken bones. There is covering around bones. There's covering of the bone inside, and when it's lining the medullary cavity, we call that endosteum. If it's around the bone, the outside, we call it periosteum. Very similar to our covering around cartilage called perichondrium. It's a fibrous material, but now because it's around bone, we say it's periosteum. Endosteum lines the medullary cavity. That outer layer, the periosteum, has to be anchored to the bone deep to it. That periosteum has a fibrous layer, and then deeper to that, this is where we're going to find a cellular layer. This is very similar to the perichondrium when I showed you the appositional growth, where underneath the perichondrium there were those stem cells. So just under the periosteum there will be a cellular layer. We're going to see that there are some immature bone cells that are also replicating and dividing, and they make the bone thicker. Over here you're seeing spaces in the bone. Those are lacuna, and those would be occupied by osteocytes. Osteocytes are mature bone cells, and they are born from osteoblasts. So those osteoblasts, think B for blast, B for baby, think immature. But eventually they will finish their differentiation process. Also underneath the periosteum, we can find this large, ruffled cell with lots of nuclei. And that's called an osteoclast. So we have three cell types we have to keep track of. An osteoblast, which matures into an osteocyte, and then a totally different cell called an osteoclast. The osteoclast is huge, it's ruffled, it looks like the blob, and it has lots of nuclei.
Are blasts always going to be immature? Because chondroblasts are
Immature
as well. Right?
Yes. When we use site, then that means to the scientist that cell is fully differentiated. You can all think of yourselves as anatoblasts, right? You're just starting anatomy. When you finish anatomy and take the final and pass, you're anatocytes. I don't know, I'm making this stuff up. It works. It's just an example. The osteocytes that are deep into the bone, living in their cavity, they can be really far away from the blood vessels that I showed you. And so they build little tunnels to communicate to each other, as if to pass back and forth notes, but they're passing nutrients and waste products, getting the nutrients to the deeper cells further away from the blood vessel, and the outer ones are pulling the waste products towards the blood vessel. Those little tunnels are called canaliculi. It sounds like a really bad bar pickup. Hey baby, canaliculi? You want to lick my wada? Your canaliculi. Nope, not a bad bar. I think so. Now that's not the same as those perforating fibers. Canaliculi are tunnels. Perforating fibers are also called Sharpie fibers. They're the ones that help anchor the periosteum to the bone deep to it. I'm going to tell you what the osteoclasts do versus the osteoblasts and osteocytes. Osteoblasts, B for blast, B for baby, they're all about, they make up the bone around them. Osteocytes do that as well. That's their job. They build it up. Where do we find them? We can find the osteoblasts underneath those fibrous lines, or linings, I should say, under the periosteum and also under the endosteum. I'll explain what mesenchyme is in just a moment. It sounds like a scary term. It comes from embryology. We wait until the end of the semester to cover embryology. Seems kind of backwards, but that's how I do it in this class. So I'll explain what that is in just a moment. Osteocytes, mature cells, they live in the lacuna. They still help with the bone matrix. Their job is to deposit the bone, build it up, strengthen it up. Osteoclasts, shown over here, large cell, ruffled border, lots of nuclei. Why? Because it came from a lot of precursor osteoclasts that merged together. And those vesicles that you're seeing in this picture are filled with hydrochloric acid. And when they dump the acid onto the surface of your bone, they are removing the mineral from your bone. And that sounds horrible. That sounds like it's going to make your bone weaker. It can. In physiology, there's a term we have called homeostasis. Homeostasis. And Claude Bernard was a French physiologist that first coined that phrase. And in French, he used milieu intérieur, which means a stable internal environment. If you want your bone to be stable over time, you have to have a balance between the osteoblasts and osteocytes building the bone and the osteoclasts that degrade it. We have bone remodeling. Right now, Mac, the little piece of bone that's sticking out, we want his osteoclasts to shave that down. We want them to win there, but not everywhere. So we want balance. Sometimes we want the builders, the blasts and the sites to have more control. Sometimes we want the osteoclasts to have more control. When would that be? It depends many times on your electrolyte balance of calcium. If you have a lot of calcium in your diet, you switch more of the scale to the builders. They're going to take that calcium and they're going to say, we're going to store it in the bone. We're going to store it in the bone for a bad day. And then let's say you don't drink enough milk. You don't eat enough cheese. Say that's just not your thing. Well, then your osteoclasts are going to say, I got to get this calcium back out in the blood, or you're going to die. You're going to learn in the next few weeks. Skeletal muscle contraction relies heavily on calcium. So does neuronal physiology. If you start mucking with calcium, a lot of your excitable cells, brain, heart, smooth muscle, skeletal muscle, come to a screeching halt. You will die. We don't mess around with calcium imbalance. We really do not. So your osteoclasts, they save you when you aren't getting enough calcium in your diet. You're saying, fine, I'm going to take it from the bone. Got to put it out there. Now your bone's getting weaker. Calcium is abundant. The blasts and the sites, they go, we're going to save this for a rainy day. Don't know how long this is going to work. It's like the Mormon pantry. You've never heard of Mormon pantries?
No.
I'm not being mean when I say that's a real thing. I grew up on a street where there were more Mormons than any other religion. They believe in stockpiling food. There's Mormon pantry, tons of food. No? Okay, it's a real thing. I'm not trying to be evil and discriminatory. It's a real thing. Anyway, so osteoclasts are not necessarily a bad cell. They're doing a huge job to regulate your blood calcium levels. When they get low, they kick into gear. And they bring your blood calcium levels back up so that your heart can function, your brain can function, and your skeletal muscle and smooth muscle can function. They look ugly. Hydrochloric acid sounds nasty, sounds bad, but it can be a good thing. Yeah.
Where would the excess calcium be stored?
In the bone.
In the bone.
Yeah. So it turns out that there is a hormone that I'm going to tell you about called parathyroid hormone. I have to be careful with that. In 7 minutes. Getting close to that discussion. But let me explain the balance in just a moment. First of all, your bone matrix is organic and inorganic. The inorganic, the mineral part, is the calcium hydroxyapatite. Don't memorize the molecular formula. I'm just showing you that there's where the calcium is going. The organic part is the collagen fibers. And the collagen fibers are creating they're in these rings. And the collagen fibers are oriented in different directions for every ring. And this allows torsion of your bone. Not a lot, but at least allow it to wiggle a little bit. Now, you can do a cool experiment. You can take some chicken bone, clean it off. You don't want this to be a nasty experiment. Clean off some chicken bone, put it in a jar of vinegar for about a week. The vinegar, being an acid, will erode just like the osteoclast, the mineral part of the bone, leaving only behind the collagen. And when you take out that bone after a week, you would be able to bend it like this. Yeah, you can. If you get a big rib bone and do this, you could even maybe tie it in a knot. Try it. Then the other experiment you can do is you could put your oven to about 500 degrees. Put a chicken bone in there. Well, don't burn it, because it will ignite on fire if you don't watch it. Remember, there's fat inside. So put it in there about 10-15 minutes. Take it out, let it cool, and you'll be able to crumble it with your hands, because the high heat kills off the organic material. So that's just two cool things to do to prove to yourself that there are two different kinds of matrices in here. I already said it's vascular and innervated. Now I need to tell you about compact bone and spongy, also known as callus bone. Compact bone, we see those repeating units called osteons. We know what lacunae are. These circular rings from the collagen fibers, those are called lamellae. Osteocytes live in the lacunae. Those spidery-looking appendages from the lacunae, those are the canaliculi, remember the bad bar pickup line. In the middle, we see a central canal. What would we find in there? Blood vessels, arteries, veins. We'd also find neurons, nervous tissue. There are perforating canals, but I need to show you on a different picture. Perforating canals are blood vessels coming horizontally through the bone, not just going through the central canal. And then I'll show you a picture of bone marrow. Do you have yellow marrow or red marrow at this point? How many of you are younger than 20? You still have red marrow. If you're older than 20, more of your long bones, your medullary cavity, filled with fat. And you can't work that off. So you are gaining more fat as you age. Diploid refers to spongy bone that is surrounded by hard compact bone. And we see this kind of arrangement in our flat bones of our skull. Most of our skull bones are this kind of arrangement, the diploid in between the compact bone. There really isn't a medullary cavity. As you can see, it's still, to me it looks like an English muffin with the nooks and crannies in the middle. There's no really cavity in there. Now, bone, like cartilage, has two ways that it can increase. There is intramembranous ossification, scary language meant to intimidate. And on the next slide, you're going to see endochondral ossification. Intramembranous ossification and endochondral ossification are in your homework packet. I use the pictures from the book, and I just want you to identify the steps. Keep it simple. With intramembranous ossification, it starts out with mesenchyme. What the heck is that? Carrie, you said you were going to explain it. Mesenchyme comes from a layer of you when you were first developing, when you were an embryo. There was a top layer, a middle layer, and a bottom layer. You were 3 sheets big at one point of cells. The top layer was called the epiblast. The bottom layer was the hypoblast. And the middle layer developed into something called mesoderm. Think M for middle and N for mesoderm. And this tissue basically will create everything that's in the middle of you. Everything that's in the middle. Epiblast created ectoderm, which creates the outer wall of you. Then the hypoblasts will create the endoderm, which is basically the middle tube going through your body. You do have a tube going through your body, right? You know that. Okay. If I were, when Hayden was little, all he ever wanted when he woke up in the morning when he was a toddler, every morning I'd ask him, what do you want for breakfast? And he'd say every morning, peas and corn, Mom, peas and corn. Peas and corn. So he'd eat bowlful after bowlful of peas and corn for breakfast. Later on that day, he would have a bowel movement. This was when he was still in diapers. And he wouldn't eat, he wouldn't chew real well, he would just swallow these. Corn has fiber, it has cell walls, it's plant material. So if he didn't chew it, it just came out whole, and I would change his diaper going, I could just wash this off and reuse it. So imagine if I ate a big kernel of corn, tied it to some dental floss. It would travel into my oral cavity, back into part of my pharynx, into my esophagus, into my stomach, into my small intestine, all three parts, duodenum, jejunum, ileum, to my ascending colon, to my transverse colon, to my descending colon, to my sigmoid colon, to my rectum, to my anus, and I could poop that out just like Hayden did, and the dental floss. We are a tube surrounded by another tube. So our mesoderm makes the middle part of us, our stuffing, our connective tissue. Like going to a Build-A-Bear workshop. Stuffing you put in there, mesoderm. So this mesoderm travels. And when it travels, we call it mesenchyme. Just means traveling mesoderm. And all of a sudden you get all of these mesenchymal cells, and they start grouping together and they start communicating. They start sending chemical signals to each other, and that starts them to become determined and differentiated. They get all close together. They start communicating, saying, hey, you want to switch over to a new kind of cell type? They go, sure, let's all do it together. So they start turning into osteoblasts. They start depositing that bone matrix. The bone starts to become calcified. And then what we see here are blood vessels infiltrating that bone material and bringing with it osteoclasts. And the osteoclasts start chewing out these little cavities, and this is how we make those cranial bones that I told you. We had the compact bone on either side, and then the English muffin appearance in the middle. So here's our compact bone. Here's our periosteum with our pre-osteoblast cells, compact bone, and then this is the diploid in the middle, the English muffin-looking spongy bone. Let me go through endochondral ossification, and then I will let you go for a break to lab. Endochondral ossification, we don't start with mesoderm. We start with hyaline cartilage. This is how most of the bones in your body are formed. Hyaline first. Then again, chemical signals are sent out. The cells start to change. They become determined, and they're going to differentiate. What are those chemical signals? We just call them differentiation factors. What made you decide to come back to school? What made you decide to start this journey? Each of you has your own story for that. What motivated you to make you change? And now you're all banding together, and you're becoming more and more determined, and eventually you will become differentiated. So cells do the same thing. Was it a conversation you had with your parents where they said, if you do not go to school, you're out of here? Yep. Is it because you know that you should be gainfully employed if you want to appear attractive to someone to become committed in a relationship with? You can pick which person. Is it because you've been a stay-at-home mom and now it's your turn? All of you have your own reasons why it made you morph into something different. You're starting the journey. Cells do the same thing. So these cells start to have this bone collar. The perichondrium is replaced by periosteum. And that means we have different cells inside. And the cartilage is now away from blood supply. It's no longer getting blood. The cartilage is going to die. It wasn't vascularized to begin with. So now if you add a bone collar, it's really far away from diffusion of nutrients. Then we have blood vessels actually invade the diathesis, the shaft. And as they invade, they bring with them those precursor cells that are underneath the periosteum. And say, let me bring you into a new home. And they start taking over. So we get a primary ossification center. When blood vessels start to invade the epiphyses, bringing new cells, again, everything morphs and changes. We go from cartilage to bone. Why? Chemical signals, differentiation factors. And then we get our secondary ossification centers. And then in the middle, the osteoclasts, they come in and they start chewing up all of this bone and calcified cartilage in the middle, and that's how we get our medullary cavity. Have fun in lab. Bye. We left off talking about the ways that bone grows. There is intramembranous ossification and endochondral ossification. Those are just steps in your homework packet that I want you to just rewrite from your textbook. Don't go into too much detail. I do not ask you to write a short answer response on it. I just want you to know the steps. This is another picture showing you the epiphyseal plates, or growth plates as we call them. And this is a unique place in the bone where you still have mitotically active cartilage. And there are different zones. So zone 1, shown up here, is the furthest away from the medullary cavity. So it's closer to the end of the bone, the long end of the bone. Does anyone remember what that is? The epiphysis. That's why it's called the epiphyseal plates, right? So and then the diathesis, remember, is another word for shaft. So this is cartilage just hanging out. And this zone, you see a lot of chondroblasts stuck in liquidity. They are mitotically active. And then down here, they start to slow down, and they actually start to die. Because they're dying because they're getting pushed further and further away from nutrient sources. Remember, they don't have their own blood supply. They are avascular. They still require nutrients. They have to be close enough to a blood supply for diffusion of those nutrients to get to them. So the further away they are pushed down, they start to die. They cannot maintain the matrix of the cartilage. So then it becomes mineralized. We call this calcified cartilage. That is not bone. It's calcified cartilage. And then the osteoblasts start to infiltrate this area, and they do make osteoids. So they'll take over the calcified cartilage, and they'll deposit bone. Eventually, these zones are going to be taken over by the bone cells, and when it is completely closed, we say that your plates have closed, and you are finished growing lengthwise. You can still have bone growth widthwise, of course. That's me recording myself to make one YouTube. There are many hormones that influence bone. Growth hormone, of course, influences many cells of the body, not just bone. Growth hormone causes cells of the body to increase their mitotic rate. And if you go back to those 4 zones that I showed you, growth hormone would influence those rapidly dividing cartilaginous cells. But when it comes to maintaining your calcium levels, on Tuesday I told you that bone is both organic and inorganic, and I told you 2 neat experiments that you could do to show yourself that. The calcium, you heard me say on Tuesday, and I shared the story about my in-laws. That is a really important story. We go after it pretty hard in physiology. In your anatomy book, it says that calcitonin is the hormone really important for bone deposition. Actually, it's not. That's not correct. Calcitonin was important early on in your development when you were a fetus, but once you're born, the regulation of calcium either being deposited in the bone or taken away and put into the bloodstream is under parathyroid hormones functioning. When you don't have enough calcium in your bloodstream, your brain cells can stop functioning, your heart can stop functioning, all muscle can stop functioning. Maintaining calcium in your plasma is important. When it gets too low, parathyroid hormone is released. And this comes from the parathyroid gland. Para means next to the thyroid. In fact, there are tiny little glands that are embedded within your thyroid gland, which is the largest, purest endocrine gland in your body, and you can palpate it, you can feel it. It's right here, the anterior surface of your throat. So these tiny little glands, they're responsible for a lot. When your calcium levels go low, parathyroid hormone goes up in your bloodstream. It then targets the osteoclasts to have more control. Do you remember what I told you the osteoclasts do? They were the large blob-looking cells that were multinucleated, and they had vesicles filled with hydrochloric acid. And they spill this acid on your bone to resorb the calcium and then put it in the blood. When your blood calcium levels go up to where they should be, then parathyroid hormone comes down. You don't have as much of it, and it takes away the control away from the osteoclasts, and now they are subdued. They're quieter. They're not stimulated. And this now gives more control to the osteoblasts and osteocytes, whose job it is to put down more bone matrix. So that's the balance, really, of calcium. This is the typical picture from textbooks saying, oh no, it's calcitonin. It's actually not. And in physiology, there's a bigger story behind it that I teach you, and I draw it all on the board. That is beyond what you need at this point in anatomy, but you need to trust me that that picture, really all it comes down to, you can delete this part, it comes down to parathyroid glands. If there isn't enough calcium, we give more control to the osteoclasts. When the calcium comes back up, parathyroid goes down, osteoclasts are no longer stimulated, the other bone depositing cells now have more control. Other hormones that can stimulate bone growth are, of course, steroids. Testosterone has a more mitogenic effect, that means increased mitosis, than estrogen. That's part of the reason why that men grow typically taller than women as an average. There's also other vitamins that are important for the synthesis of the bone matrix, like vitamin A, vitamin D. Vitamin D is very important. Parathyroid hormone can't work right without vitamin D. So you need vitamin D either from, you can make it on your own. You can't, just need to go out in the sunlight. You have a precursor form of it in your skin. You go out in the sunlight, and the kidneys help convert this to a usable form of vitamin D, and then parathyroid hormone can do its job better. That's why it is important to get some sunlight. Have any of you ever heard of something called the Industrial Revolution? You've had some history, have you? Well, what was unique about that time was child labor was heavily used. We can't really do that anymore. And the children were hired to work in the factories a lot because they had the power of small. They could fit in between all the machines and fix things if they needed to. And the extra income that they brought back to the family, well, then of course the parents were like, yeah, you're going to keep working. And they didn't really attend school. They were just in these factories for long hours of the day. And they never saw the sunlight. And what happened to them, do you know? Their bone structure, their bones got soft and they started to get bowed legs. And that kind of disease in a child, that's called rickets. That's what they had. So you do need some sun. I'm not advocating that you go outside and sunbathe 8 hours out of the day. You don't need it. But some sun you do need. And vitamin D levels, vitamin D about 10 years ago was considered to be the molecule of the year with scientists. There were so many laboratories studying it. They found that low values of it were linked to certain types of cancer. They were also found low values of it were also linked to certain kinds of mental health issues. So you need your vitamin D. It's nothing to go, I don't need it. Yeah, you do. And this should look somewhat familiar to you, right? You've been studying your skull and your vertebrae. When we are talking about the axial skeleton throughout life, when you're first born, your head proportionally to the rest of your body is just, it's kind of freakish. Even through your toddler years, ever watch a toddler just starting to walk when they now can walk, but they still they kind of lead and steer with their head because their head is so big and the body just kind of follows with it. When their head is born, there are soft spots. I'm sure Professor Innens has shown you the fetal skull, or has she not yet? Yeah. We do have a real fetal skull in the classroom next door. They have soft spots, and these are called fontanelles. The bigger ones are the anterior and posterior fontanelles, and there are also some on the side. You've got the sphenoid and sphenoid fontanelle and mastoid fontanelle. So those are the ones on the side. Those two on the side close up pretty quickly. The posterior fontanelle closes up within months of life. The anterior one can take up to 2 years. Has anyone seen the movie or read the book, The Giver? Very depressing. It's a book basically about making this very advanced society the healthiest, smartest, the fastest, just utopia out there. And in one part of the book, the twins are born, and the character in the book is trying to figure out which of the two twins is the stronger, which one had the higher birth weight. And this person is measuring them and analyzing them and ends up deciding that one is just had slightly lower birth weight than the other. And so he takes a lethal dose of some sort of drug and injects it into the baby's brain through the anterior fontanelle. Just kind of a depressing way to remember that. But it is open. It's a soft spot for about 2 years. The purpose of the fontanelles is when the baby is born, or actually coming through the birth canal, that's a lot of pressure, and you need some squish room. And those bones are sort of like tectonic plates. They kind of shift in that process. It's creepy. If they fuse early on, if they fuse in utero, and that can happen, when the infant is born, the pressure from the mom's uterus and cervix and vagina can actually cause the bones to bow in the sutures, and the baby will be born with skull deformities. They aren't permanent. We can fix them. But, have you watched Family Guy? Stewie has that football head. If those side fontanelles I was just telling you about fuse early, that you can actually have a baby born looking like that. That's not just someone's made-up idea. Another way, if the sagittal suture is in place too soon, you can actually get the squishing of the parietal bones this way, and they look like they have a sail, like from a sailboat, on the top of their head. So I know it sounds gross, but that can happen. So that's premature ossification. Vertebral column, we have primary and secondary primary and secondary curvatures. Which ones are primary? Those are the ones that you're born with. And I want you to think about if you were holding an infant. We cradle them, and we cradle them this way mostly because that's how they are. They're like this, right? So you're born already with your thoracic curvature, and you're also born already with your sacral curvature. They go this way. When the baby starts to learn how to lift their head and starts developing those neck muscles and using them, then the cervical curvature is the next one to develop. Then when the baby learns to sit up, then you get the lumbar curvature. And so those cervical and lumbar curvatures, they go in a different way, a different concave, convex, depending on which perspective you're taking, compared to the thoracic and sacral. This gives us kind of an S-shaped spine as we develop, and it acts like a spring, and this helps absorb some of the compression forces when we're walking and when we're running. The skull has areas in it where we have pockets called sinuses. This helps lighten the load of your skull. You can remember this with the acronym FEMS, F-E-M-S. Frontal, ethmoid, mastoid, sphenoid. Those are where we find sinusoidal cavities. How many of you get sinus headaches? Where? Do you get them around your upper jaw? Those are painful. You get them up above your brow? So those are probably sites where you're developing infection. You get a lot of inflammation. You get a lot of congestion. And there's a lot of pressure now, and there are nerves in these areas, and that's why you start feeling the pain from them. It's kind of cool. There's a hole way up here to get into the maxillary sinus here. Did I say mastoid? I meant maxillary. Still on the fontanelles. There's a hole way up here. So if you want to drain your maxillary sinuses, there's truth. You have to kind of hang upside down so that it can get to the hole that's way up here and then drain out your nose. They also have those little teapot-looking things where you stick them up in your nose to kind of flush out the infection in there. Doctors use those too. So that usually is the one that's the culprit and gets infected the most. But then the next one is the frontal one. Let's see. So those are paranasal. Facial bones, of course, are important because you're going to learn as you get into the nervous system. I think you're already learning about them. There are a lot of holes in your heads, right? Too many, right? Foramen ovale, spinosum, rotundum, lacerum. And lacerum, technically, when you're alive, is not really a hole. Did you know that? It's closed off. It does not exist in the living skull. It's only when you're dead, and there's cartilage actually there, and then it erodes, and then you see the lacerum. So now you're probably saying, then why do I need to learn it? Because you do. There are blood vessels that go through some of these things. There are also nerves that are going to go through them, and many of the nerves that are going through them are going to help you with your special senses, like smell, and taste, and hearing, and sight. For example, did you already learn the ethmoid bone? Mm-hmm. With the cristagalli? Yes. Cristagalli means rooster tail, right? Yes. And then you have the cribriform plate. Yes. And the little holes in it are olfactory. Good. So what sits there in the cribriform plate are your olfactory bulbs. They just sit there. They look like little fingers. And you'll see this when we dissect the sheep, right? And then what hangs from them are your olfactory nerve endings. And they're just dangling way back here in the back of your nasal cavity. And that's why when you breathe in through your nose, you can smell all those wonderful smells from the person sitting next to you. And then suture lines, I'm sure you started studying those. Like sagittal suture, rhomboidal suture. Those are from the bones actually forming joints, and sutures are special types of joints that we'll learn about. I already told you a lot about the vertebral column. In the adult, there are 26 bones, but in the fetus, we're born with more of them. The sacral bones start to fuse. The coccygeal bones also fuse, and that's why we end up in 26. Of course, the vertebral column is important with the vertebral canal going through it, which is where our spinal cord is going to travel. And those intervertebral foramen are where spinal nerves are going to come out. You can remember the number of your bones. When do you eat breakfast? 7 a.m. And then when do we typically eat lunch? 12, so 12 thoracic bones. When do we typically eat dinner? 5, so 5 lumbar bones, right? And then we get to the sacrum and then the coccyx. The coccyx, I mean, that can be variable how big your tailbone is. Some people have a lot of bones that are part of their tailbone, and some infants are born with such a long tailbone that they can look like they have a tail. And we just kind of snip that off and suture up the skin and call it a day. It's not the worst thing that your baby can be born with. Let's see what else. You also learned that the thoracic bones are points where you have the ribs attaching to it. Where are you in your bone studies, I should ask?
We just finished all of this on Tuesday.
You finished all your bone list on Tuesday?
No, the vertebral, all the
vertebral.
axial.
Okay. And so can you identify your vertebrae by sight now? Which one's the giraffe? Thoracic. Which one is the moose?
Lumbar.
Lumbar. Good. Which one has the earring holes? Cervical, right? The transverse foramen. They also, some of the cervical bones have the bifid spinous process. They kind of look like a snake, right? So that's how you should be able to identify them by sight. We also ask you to know the difference between the atlas and the axis. And the axis has the odontoid process. It looks like it's a little penis, doesn't it? That's how it's the bone. That's how I teach it in lab too. I said, find the vertebral bone that looks like it has a penis. And, you know, they're like, this one. Good. You are right. You can also call the odontoid process the dens. Again, there are always 2 names for everything in anatomy except for when there's 6, that there are 7. Yeah.
What is the sacred piece? What's the significance of that?
What is the significance of that? Well, that's a good question. Why do some bones fuse and others don't? Some bones fuse because they are not being moved across each other, and so there's an opportunity for them to fuse their matrices. For example, your hip bones, your pubis, your ischium and ilium, you don't really want those wiggling around with the femur, the head of the femur moving around in there too, right? We would have no stability. So bones fuse when you need the greatest stability. When we are using them the most, we don't want them to fuse. In fact, some people do get some of their vertebrae in their spine fused because they've had herniated discs or something. And they will oftentimes say, it really helped the pain when I first did that, but now I notice that I have limited range of motion. So it's all about stability, what some do and what some don't. Is that good? Okay. Intervertebral discs. There is a gelatinous part in the middle. This is our cushioning part. It's called the nucleus pulposus. It is a remnant of an embryonic structure called the notochord, which you haven't learned about yet. But since I'm bringing it up, the notochord is an early embryonic structure that actually helps when you looked How many of you know what a perimesteum is? It's a cute little organism with giant eyes on it. When you look like a perimesteum, this kind of, like a slug, you had a notochord. And the notochord was your body axis, the reference point. And from the notochord, there come chemical signals, we talked about this on Tuesday, that will direct the surrounding cells on where to go, what to turn into, become determined and differentiated. So the notochord helps those cells determine what is right versus left, caudal, and cephalic. So what's head, what's tail, what's right, what's left. And if you think about it, where is your heart mostly found? Like this. It's not perfectly centered. It's off center, more towards the left. Where's your liver found? Most of it is on the right side. So we are not completely bisymmetral, right? We don't have, if you cut us down in half, you wouldn't see even split of all of our organs. That's not how we are. Some organs develop on the right, some on the left, and that notochord helped develop that. Some people have problems with the notochord. Many times we don't know that they had a problem, and they can have a condition called situs inversus, which is they're the mirror image of what we're supposed to be. And if everything flips, then there's no problem with the wiring, the nervous system, or the plumbing, the blood vessels. But if only part of the organs flip, then blood vessels usually don't grow in the right way, and then we do find out about them. One of the graduate students in my program, his wife gave birth, and their daughter had situs inversus in the thoracic cavity, but then not in the abdominal cavity, so she had to have some corrective surgery to kind of flip everything around. I say corrective, it's pretty intensive, but they had to flip around some of her major blood vessels. The annulus fibrosus is the outer ring. Fibrocartilage, the one that helps resist tension and compression forces. The annulus fibrosus can actually tear, and then you get some of the nucleus propulsus that oozes out, and that's what we call a herniated disc. This can put compression on the nerves that are exiting through the intervertebral foramen, and it's very painful. Have you ever had a herniated disc? You would know exactly where you are once you do it. You would hear a pop, and the inflammation, the herniation could be mild to severe. If it's mild, you might have continuous tingling in usually the herniated discs happen here in the cervical region or down here in lumbar. If it's in cervical, the person has a problem with pain sensations or tingling sensations in their arms. If it's lumbar, then it presents in the legs. If it's a major herniated disc, the pain can be quite intense, or some patients describe that they feel like their leg or their arm is on fire, or that someone has taken sandpaper and rubbed off all of their skin and they just feel raw. And yet there's nothing wrong physically with your arm, it's just the nerves being compressed. They're sending pain signals up to the brain. These are disorders of the spine. Scoliosis is a lateral curvature of the spine. On my lecture exams, these are typically matching parts. Match the description to the disorder. It doesn't get any easier than that on a test. That is just first ordered test assessment. Kyphosis is an exaggerated thoracic curvature, the hunchback, that we think of. There is a beloved professor on this campus. He's awesome, but he definitely has severe kyphosis of his thoracic cage. Lordosis, we think of the gymnasts that are trained to stick the point, and they have that big curvature in their lumbar spine. Stenosis is a narrowing where we actually get compression of the spinal cord inside. And again, it's going to present just like a herniated disc where the nerves get pinched from that compression. And there's pain, and it's pain signals being sent up to the brain as a result of that. This is also a matching section on my tests. So I'm going to tell you which types of bone breaks I want you to know. I don't want you to memorize all of these. We don't need to do that. I'm just going to give you some of the more common ones. So the first one I want you to know is an avulsion. And I'm kind of being artificial in picking this one because my oldest son, Hayden, had that kind of break. And even though I teach this, I thought, well, an avulsion, that's got to be a pretty rare kind of break. And it turns out, not so much. Hayden is my oldest. Today is his 20th birthday. He was like me. I didn't grow until I was summer between my junior year and senior year. I came back for school my senior year, and my teachers went, Kara? Because I was no longer the second smallest in my class, behind Lori Gentilini. So we always had a line up. Anyway, Hayden was super sad because for a long time in his life, because he has really good natural talent in soccer, and he, at a young age, wanted to be competitive. It was pretty intense, and he was good. He thinks on the field, and he plays defensive center mid, and you really have to think in that one and be controlled and keep the team calm. And he was always team captain. Even though he was defensive center mid, he always either had the highest goals scored for the team or assists. It was one or the other. And then he got into around 6th grade, and all the boys on his team started to grow, and he did not. And over the next many years, because he wasn't growing, he was being muscled off the ball. And if you're not winning balls, you can't make passes. So he went from team captain to not being team captain, to not starting and playing the whole game, to sitting on the bench the whole game. It was really frustrating for him. And his coach would say, I just need you to grow. And I'd be standing there, oh yeah, that's something. Well, let's get right on it, son. And he was so sad. And one year he had a checkup, and he asked the doctor about it. Will I ever grow? And the doctor said, well, your dad's here. Let me meet. How tall's your mom? So the doctor just said, you probably won't exceed 5'8", 5'9" if you're lucky. He came home in tears. And so I had to say, honey, there are a lot of soccer players that are not 6'3". There are a lot of them that are professional. Not that you're going to be professional because you're not that good, honey. Well, I'm sorry. I believe in being honest with my kid. They're not. Most of them are not good. That is probably reality, and let's just get that Band-Aid ripped off right away. It's a harsh household. But a lot of good soccer players are not 6 foot. There's some that are very good that are shorter stature, and it's all about the skill. And now you can be that little guy getting in between their legs and frustrating them. Oh, but he was in tears. I said, the doctor doesn't know anything. Did he take an X-ray? No. I said, you are just like your mother. He looks like a male version of me. I can show you a picture of me. You're like, yep, that's you. I said, you're just like me, and your younger brother is a spitting image of your father. So I think you're going to have my growth timing. There's a timing and tempo. Timing and tempo. I didn't grow until late. I think you're going to be the same way. Sure enough, junior year, senior year, he starts growing, and he grew so fast. Teenagers have a growth rate of toddlers. I mean, it is phenomenal how fast they can, and you know this, you've got 6, right? So he grew so fast that the beginning of his senior year at soccer practice, he went to take a kick, and here's the avulsion. His muscle was growing very muscular, and his bone couldn't keep up, So when he went to do this big kick, he pulled off his superior iliac spine. That's an avulsion. That's an avulsion. And there's no cast you can put on that. It is just rest, physical therapy, and there's very rarely will they do surgery to put it back on. So he heals. He misses the first season-ish of training and practice games. He finally heals. The doctor says, yep, you're good to go. The x-rays look good. Very next practice, he goes to, because he's also left-footed, he goes to do a big kick with the left foot, pulls the other one off. And he ended up sitting out his entire senior year for varsity soccer. I know. Super sad. So I want you to know that one. The bone is definitely broken in 2 or more pieces. That's what I want you to know. Epiphyseal, we talked about this. This is where you break your bone through the epiphyseal plate. Green stick. So Mac had a complete break with his distal radius. Green stick, Mac's best friend, who's also playing for high school with Mac right now. He fell, and he ended up breaking his radius, but he had a green stick break. And they didn't initially catch it on the x-ray. It looked like he had a splinter. But when they did another x-ray, because they couldn't figure out why it was taking so long for him to heal, they realized that he had this green stick. So the name tells you if you take a green stick and try and break it from a tree, it doesn't really break in two very easily. It doesn't snap. It kind of splinters off on the other side. And that takes a little bit longer to heal. So now Seth is looking at sitting out his entire sophomore year of soccer because of that break. Let's see. Simple. Mac and Seth both had simple breaks. Their bones did not penetrate through their skin. A compound bone, that's where it does break through the skin. Those are nasty. That's when you're seeing bones sticking out. You don't really need an x-ray to prove that it's broken at that point, do you? It's kind of like, well, that shouldn't be like that. Many times a simple or closed bone break does not need to have surgery to repair it. You don't need the rods and the screws and the pins, but sometimes they do. It depends what bone you break. One day I was with my mom and we took my brother to the emergency room for unfortunate reasons. We were 51-50ing him. Do you know what that means? Yeah. Okay, so it was unfortunate. And we're in the emergency room waiting. I'm with my mom. And this poor mother comes in with this entourage of children. What it looked like to me was she had the play date group at her house that day. And some of the kids were on hoverboards. And hoverboards have this tendency to run out of electricity. When that happens, they stop. And if you're on them, you don't. You've got the momentum. And so this poor kid got launched off his hoverboard, fall on outstretched hand. He had a simple break. It wasn't protruding. It was his radius and ulna clearly both had snapped because his forearm was hanging in a way it shouldn't be a 90-degree turn right there. And all these kids come in. Some of them didn't have shoes on. You could tell the mom was just like, go, 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 man, let's go. And so she comes in with all these kids, and she's up at the desk trying to fill in, and the poor kid is just, oh, and all the other kids start crying, and they're like, we're praying that you don't need surgery. And he's just like, ah! So my mom and I, trying to be helpful, we go over, because they had their shoes, they just weren't on. So my mom goes to the mom and says, I'm a retired nurse, we're going to help the kids. You take care of the paperwork. We got them, we'll watch over them, it'll be okay. So I'm like, okay, I'm in the heat of the moment, I'm helping. And then what I don't do well with is when I see someone in pain. That's why I could never be a nurse unless I'm an OR nurse. If I see you're in pain, I start to empathize. And as future nurses, you cannot have empathy. Empathy means you get locked in the moment and you don't see a way out. You become the patient. You should have sympathy, which means you understand what they're going through, but you know how to get them out of it. I cannot do that. So I'm putting on shoes and I happen to look up and see the boy and his pained face. And next thing I feel the blood leave my face. My heart suddenly is in my ears. And I hear the and I break out in the sweat. And I went down to the floor. And I crawled out of the emergency room through the sliding doors, past the security officer. He's just watching me. And it's like military crawl. And I get outside, past the two paramedics that were standing outside for the next, and they're just looking at me. That's it. And then I found this potted plant outside, and I was like, I think I need to feed you. No one checked on me. I can't handle that. So those are the breaks I want you to know. Avulsion. Simple versus compound, complete, epiphyseal, green stick, and I think that's a good sample. Good? Now, speaking of bones breaking, there are other disorders of bones. There is osteoporosis. We talked about that on Tuesday, the lack of the mineralization. Osteomalacia, that is a vitamin D deficiency in an adult. In children, we call that rickets, but that's technically the proper name. Paget's disease, this is where we have osteoclasts that have too much control. They're not being regulated well by parathyroid. Parathyroid hormone levels might be low, which means osteoclasts should have the brakes put on them. And they're like two middle fingers up going, no, not going to listen. And they keep resorbing the bone. And the osteoblasts try to keep up and repair it, but it's very poorly formed bone. Sarcoma, that is cancer of the bone, and in this case, osteosarcoma is malignant. It is not a good type of cancer to have. Are there any questions?